In this video, I'll reveal the truth about pancreatic cancer. What are the first signs and symptoms? Would you know how to spot them? Do you know what they are? What types of pancreatic cancer exist? What are the causes? Is there a way to prevent it? I'll tell you everything about pancreatic cancer. Today, I was reading the comments. I saw many people asking about pancreatic cancer. This is very recent, just from the past few days. In the last 4 days, many comments are about pancreatic cancer. There's a lot of misinformation, and it's a unique disease with two main groups, endocrine and exocrine tumors. I'll explain more about this and you'll understand. I'm sure you will. These two groups have completely different signs and symptoms. They're distinct diseases despite being in the pancreas. As an endocrinologist, I often treat endocrine tumors. What are they? They're hormone-producing tumors like insulinoma, glucagonoma, vipoma, and gastrinoma. These names are complex, so I won't go into detail. But note the most common one, insulinoma, which we'll discuss further. It occurs when insulin-producing cells multiply uncontrollably. On the other hand, the most common exocrine tumor is pancreatic adenocarcinoma. Let's discuss the signs and symptoms, which are completely different for each. Insulinoma, the most common endocrine tumor, causes symptoms from excess insulin, leading to very low blood sugar. What are these signs that blood sugar is dropping too low? Sweating, cold sweats, mental fog, trouble thinking, shaking, heart racing. It feels like your heart's in your throat. If blood sugar drops too low, it can lead to seizures or even coma. These are the most common signs and symptoms of insulinoma. Since it produces hormones like insulin, insulinoma shows symptoms earlier than adenocarcinoma, the other type. If a doctor can spot these signs and run the right tests, the chances of curing it are really high. How high are we talking? In my experience with insulinomas, cure rates can top 90%. We look at 5-year survival rates, the odds of a patient with insulinoma being alive after 5 years. With treatment, survival rates can exceed 95%. So despite being a tumor with serious consequences, if caught and treated early, the prognosis is very good. I'll discuss treatment later, but now let's compare it to pancreatic adenocarcinoma. As an endocrinologist, I refer these cases to specialists. I don't treat these patients, but I diagnose some based on suggestive signs and symptoms. Unlike insulinoma, which can show early signs when the tumor is small, adenocarcinoma is different. In the initial phase, patients typically don't experience any noticeable signs or symptoms. It's often discovered incidentally during other exams, like CT scans of kidneys or lungs or ultrasounds. These may reveal a nodule or mass suggesting early-stage pancreatic adenocarcinoma. Then, further investigation is done, often before symptoms appear. In moderate to advanced stages, it presents signs and symptoms that suggest the diagnosis. What are these signs and symptoms? I've split this into 9 topics for clarity. Pay attention, as this is the most common type of pancreatic cancer. The number 1 and most frequent sign is unexplained weight loss. What kind of weight loss should we investigate? 10% of body weight in 6 months or less. This is a red flag that you might have pancreatic cancer. Unexplained weight loss. No diet changes, no new exercise routine, no known cause, yet you're losing weight. It's a warning sign. You need to check if it's not a pancreatic issue. The second common sign is nausea, vomiting, feeling full, and loss of appetite. The third sign is abdominal pain. Usually this pain is in the epigastric region. Where's that? It's in the pit of your stomach, to put it plainly. This pain can also spread to the back, feeling like a band around you. You'll feel pain across the upper abdomen, not just in the stomach area, but I want you to focus on the stomach region specifically. The fourth sign is yellowing, also known as jaundice. Why? High bilirubin in the blood can cause yellowing in pancreatic cancer. This yellowing is first noticeable in the eyes. With lower bilirubin, eyes may yellow before skin, so stay alert. As levels rise, skin yellowing becomes more apparent. The fifth sign is itching. Bilirubin buildup can also cause itching. Often patients don't link this to pancreatic cancer. I worked in medical wards for years. When patients had pancreatic changes, many didn't report it as a symptom, but when asked directly, directly, they'd confirm it, as increased bilirubin can cause itching. Sometimes there's no connection, but it's still good to know about. Sign number 6 is a change in urine. The urine may become darker. Often it can darken to the color of a soda, which we call coluria, and the stool may turn whitish. This also happens, and it's a very noticeable sign. Sign number 7 is increased blood sugar levels. But not everyone with diabetes is at risk for pancreatic cancer. It's like a puzzle. One piece is pancreas dysfunction, leading to increased blood sugar without cause. When combined with other symptoms, it's a key factor we consider. Unlike other symptoms like jaundice, which needs immediate investigation when isolated, that pain I mentioned earlier, yes, that needs checking when isolated. Diabetes and high blood sugar need other symptoms to warrant investigation, okay? Don't panic if you have diabetes, but unexplained blood sugar spikes with these symptoms I'm describing are concerning. The 8th sign is fatigue. Why? Pancreatic cancer can cause anemia, leading to low hemoglobin and poor oxygenation. You might wake up tired or struggle with stairs you once climbed easily. The 9th sign is thrombosis or blood clots, which increase with pancreatic cancer. This sign is particularly dangerous. Why? These clots can travel to the lungs, causing a serious complication called pulmonary thromboembolism. So you need to pay close attention to this sign here, which is thrombosis. Now, what causes it? How can we prevent it? Is it even possible? The first group is endocrine tumors, specifically insulinoma. The main cause is genetic, and it may come with other diseases that increase the risk of insulinoma. Unfortunately, there's not much we can do to prevent insulinoma. We can investigate early through associated diseases. There are even genetic tests that can assess your risk, but you can't really avoid it. It's not linked to lifestyle or anything you've done. It's a genetic change that ultimately causes this. In the other group, we have exocrine tumors, mainly adenocarcinoma. It has genetic factors and syndromes that increase risk, plus cell mutations. It's also linked to other factors like chronic pancreatitis. It's important to be aware. Other risk factors include smoking, obesity, sedentary lifestyle, and a diet high in ultra-processed foods and processed meats. So this type of cancer, while genetic, also has other factors that can increase the risk. That's why it's crucial to take care of yourself. I always stress the importance of a healthy lifestyle to reduce your chances. Why did I say reduce? Because some healthy people with good diets and exercise habits still have a strong genetic predisposition, which can be decisive. So it's also vital to assess family history. Do you have any first-degree relatives with this or related cancers? I always ask patients about this. This family info helps determine and investigate early stages. Now let's discuss diagnosis and treatment, given what you know about causes and symptoms. For insulinoma, with symptoms I mentioned, tests like insulin levels with C-peptide and blood sugar during hypoglycemia can help. Why? When you have low blood sugar, what should happen to insulin? What does a normal pancreas do with insulin production? It stops, right? So in a normal pancreas during hypoglycemia, insulin levels drop. Now, when you have a tumor producing insulin uncontrollably, insulin levels can be high even with low blood sugar. This is a big clue for investigation. After confirming with signs, symptoms, and tests, we use imaging to locate the possible tumor. The preferred treatment is surgical. Surgery has a high chance of cure, as insulinoma is usually a benign tumor. What does this mean? It doesn't spread or metastasize. So surgery can be curative. Malignant insulinoma exists, but is rare, and medications can help too. For adenocarcinoma, the other major group, a biopsy is needed to confirm diagnosis when there's suspicion from symptoms or imaging tests showing a mass. This helps determine the exact type and treatment approach, usually surgery, but sometimes chemo too, depending on staging. I can't say for sure, as it could be an early stage or more advanced tumor. We need to evaluate each case. Now, I'd like to suggest a video for you to watch it. It's about dangerous supplements. Did you know some supplements can harm your heart, kidneys, and liver? It's crucial to be aware, as many are sold over the counter and are widely available. You need to learn more about this. I recommend watching this video to get more information. Take care. See you next time.